Have you ever wondered, what does a flight attendant do in the air when a medical emergency happens? Especially if there's no medical professional on board. What are they supposed to do? There's so many different medical issues that could happen. How are they trained to handle all of them, any of them, if there's no medical professional on board? Hey guys, it's Erica from America, your favorite flight attendant, and today I'm reacting to a reactor who's actually a doctor. I don't know if you know who Dr. Mike is, but I'm going to be reacting to Dr. Mike, who also does reaction videos as a doctor. It's kind of funny if you think about it, that I'm a flight attendant reacting to a doctor about a medical emergency on a plane. Basically, what I'm going to do today is I'm just going to give you the flight attendant side of the story, what the crew would do in case of this kind of emergency if there was no medical professional on board. And also, look at a really cute doctor in the meantime. You know what I mean? Come on, let's go check out the hot doc. So today I'm reacting to 3 medical emergencies on my flight by Dr. Mike. He has 14.5 million subscribers, and I've never actually reacted to his videos before. See, here he reacts to medical dramas, and I think basically gives his medical professional opinion about what he's seen, but he also reacts to TikToks and doctor stories and other things. I have only seen one video of his, and that is this video right here. Airplane medical emergency, we couldn't land. My mother sent me that video. And basically what it is about 6 years ago, he had a medical emergency. And if I remember right, it's been a while since I watched it. He was flying to Australia, and this guy right here had an allergic reaction to something, and his throat started to close down. They were over the ocean, and they didn't have EpiPens on the plane at the time. And in fact, in this video, he says that he's part of the reason that there are EpiPens now on the plane. This was 6 years ago that he made this video. And the thing is, I believe it. I really do, because 6 years ago, he was already making an influence on YouTube. He was already becoming an influencer in other ways as well, if you watch his story. But on top of that, I started 8 years ago. And I remember after I'd been there a couple years, the company sent out an email to all the flight attendants saying that basically we have EpiPens in the medical kit now. And I thought, why wouldn't we have EpiPens before? That kind of makes sense. Well, apparently it's this story from 6 years ago of Dr. Mike actually going and not only saving this guy's life on a plane, but then being approached by Congress people. I think he was approached versus him approaching other people. But they basically wanted to use him to get that put into all planes, and he helped make it happen, which I thought was really cool. Just real quick, a little bit more about him. 14.5 million subscribers, 1,100 videos, and I'm not even going to try to say his name. He's an actively practicing board-certified family medicine doctor living in New York City. He's an influencer with over 30 million followers, aiming to make the field of medicine relatable, understandable, and fun. So what I want to do today is go ahead and react to 3 medical emergencies on my flight, and then I'm going to give you the flight attendant's side of the story. Because I've been told before by medical professionals that we are not taught correctly about how to work things out. There's more that I want to say on that, but I will say it at the end. And I'll tell you why we do the things that we do versus what a medical professional on the ground might do. So there is a reason. But anyway, let's go ahead and watch this.
It happened again.
A real-life nightmare at 30,000 feet as a passenger went into anaphylactic shock.
Had a medical emergency on a flight, and they made that call.
Is there a medical professional on board on a transatlantic flight? And when I hear that there's a young man going into anaphylactic shock, that means we have to act very quickly.
I know everyone gives me a hard time that I always talk about my epinephrine airplane rescue story, but this time it happened again 3 separate times.
Are you kidding me?
It's like I'm a magnet for this stuff, but it's a story I absolutely have to share with you. It was a typical flight from New York to Paris, and the flight was going well. We took off safely, the food was about to be served, and they make that announcement. Is there a doctor on board? And I thought about it for a second. I'm like, should we do this again? Should I help? Should I wait to see if other people volunteer first? No one was volunteering, at least in my area. So I raised my hand, I stood up, I presented myself to the flight attendant and said, I'm a physician, how can I help? And they said, whoa, whoa, whoa. Are you really a doctor? I said, yeah. And they said, no, show us your card. They looked at it. They said it looks legit enough to be real. At which point someone stood up and said, well, I'm actually a doctor too. I'm an ENT doc. And I said, oh, really? Maybe you want to help? And he goes, well, unless someone needs to get their ears cleaned, I don't think I'm going to be of any help. Are you an ER doc? I'm family medicine. He goes, better you do it. I said, okay. One of the other flight attendants had already grabbed someone who happened to be a nurse, spoke mostly French, which will end up to be quite useful. We get to the back of the plane. There's an individual in tears, in pain, holding their side. I have no information, so I start asking the individual some questions. Zero English. I knew this was going to be hard, but I didn't realize how hard it was about to get. No Wi-Fi, no good internet at that moment, so I couldn't use any of my translator apps. Luckily, the nurse spoke English, so the nurse was asking the individual questions, also communicating with me in the small amount of English that they did know. Turns out, patient has a history of kidney stones, was experiencing flank pain, which is like pain kind of on the side of your body, radiating to the back. The patient said that this is the very same pain that she experienced when she had a kidney stone in the past. She didn't say anything prior to takeoff because she thought the pain she was experiencing was due to her cycle. She thought she was just getting menstrual cramps and kind of wrote it off. But as the plane took off, the pain got worse and worse. In that moment, I started thinking about the old medical story that we would tell students, how there was once a study that showed sending patients who have kidney stones onto a roller coaster can dislodge the kidney stone. I'm like, I wonder how bad the turbulence is gonna get on this flight. Obviously, I had to correct myself and course correct there and say, okay, we're not gonna have the pilot create turbulence to rattle this kidney stone free. So I performed a small physical exam, checked her abdomen, it was non-tender, normal pulse, temperature was normal oxygen level, checked her blood pressure was normal also. But when I went to go check for CVA tenderness, which is a test where we literally tap on the costovertebral angle on the back, where the kidneys are essentially. And if the patient jumps, it's a good sign that there's something going on with the kidney. Sometimes it could be kidney stone related, other times it could be pyelonephritis, which is an infection of the kidneys. So we realized that the patient has a kidney stone, is in 10 out of 10 severe pain. I realized we have to think about pain control. I asked the flight attendants, what medication options do we have in their kit? The kit that
Real quick, this medical kit. It's kind of crazy. We do have medical kits on every single plane. Absolutely, 100% positively. Do we know what's in them? No, we do not. Basically, there is a list that we can access in one of the pockets, and it'll tell us everything that's in the bag. And each pocket, there's 2 separate pockets, at least on ours. There's one pocket that we might be allowed to get into as flight attendants, but the other pocket is supposed to only be for licensed medical professionals. And they do have to show their ID, what kind of licensed medical professional that they are. We are allowed to have nurses do it. We're allowed to have doctors. I once had a paramedic on my plane, and he actually helped me with a medical emergency. But the interesting thing is we don't know what's in that kit. We do have a list of everything that's in that kit in our manuals that we travel with, but we never look at it. And we're not really supposed to open that bag. Instead, if I was on a plane alone, only flight attendant, which has happened before, and we were to have a medical emergency, my first job would be to notify the pilots, because the pilots have to talk to emergency services and figure out if we need to land immediately. They would also contact a doctor for me on the ground if there was no medical professional in the plane, and I would have to get permission from the medical doctor to follow through with whatever procedures they would want us to do in air. We would have to assess with this doctor through the phone, through the pilots who were doing it through the PA to the ground, what steps we need to do. And we'd have to go back and forth between the phone and basically the captain to get all of that information done. And like I said, I thought we already had epinephrine pins in there until a few years after I was a flight attendant and we got the email saying that they were suddenly in there. But basically a medical kit like that is a licensed medical professional only bag, and I believe only doctors are allowed to open those. Like the nurse would not be allowed to open it, but anybody with an MD after their name, and then I forget what the other one is. But even if we have a doctor on the plane, we still have to contact the doctors on the ground, and they have to give the okay that this doctor can actually do all the work that needs to be done. That's what would happen if there was no medical professionals on the plane.
I haven't seen since the epinephrine days. And now this is not Delta, this is Air France, so it's a new kit. They show me the kit, we break it open, we look into it, and we see a list of medications that are all in French.
Okay, so like I said, there's the list that says everything that's in both pockets, and it is included with every single medical bag.
Some of which are translatable easier than others, like the name just has like a little accent mark.
It's funny, I never considered what it would be like going to another country having to deal with that. That's an extra definite layer of challenge
on it. But others are completely new medications that I've never heard of. So I told the flight attendant, look, I'm not very comfortable with using these medications, given the fact that I'm not familiar with them. She said, we have to go to the cockpit. You have to speak with the pilots and ground control. I said, wow, okay. Even last time that I had my medical emergency, I didn't go in the cockpit. They came out to speak with me. So we go to the cockpit. I go in, introduce myself to the two pilots. I explain what's going on. They ask me if I think we should divert. Given that the flight attendant told me that once we leave land, which we're about to leave land from Canada, flying across the Atlantic Ocean, we will not have an ability to land in an emergency. I said, I think it's best we land. I think it's best we divert. Even though I know everyone would hate me for saying that. I was just thinking about what's best for the patient. So the pilot literally gives me his own headset. I put it on. I start speaking to someone. I say the age of the patient, the medical history, the physical exam, the vital signs. And they say, we do not divert for kidney stones, nephrolithiasis. And I said, okay, well, if you're comfortable recommending which medication to give, I'm happy to give it, but I just don't know any of these medications because they're French medications. They said, okay, give EpiPen. I'm like, EpiPen? They're like, EpiPen. And that's one of the medications that was on the list.
Real quick, EpiPen is a non-opioid analgesic used to relieve moderate to severe acute and chronic pain. Not sure what any of that means. How about you? Okay, let's keep listening.
Medications that was on the list. Actually, I took a picture while I was in the cockpit of this medication list because I was trying to get reception to ask one of these AIs to translate it for me. But on the list, it says the medicine is an injection, which means you have to either start an IV and give it through the IV or give it IM intramuscularly. The nurse, rock star that he is, starts the IV. Patient starts looking a little bit better, but still in a lot of pain, crying, sweating, screaming. I run up to the pilots to give them a status update. They say, okay, great. We're not diverting. We're leaving land. I said, okay. I go back, she's vomiting now. And this is a problem because whenever you have kidney stone pain, if it's really bad, you can develop what's known as hydronephrosis, where urine actually backs up into the kidney and starts creating damage and pain and swelling. It's very uncomfortable. And we realized we have to give her a medication for the nausea and vomiting. Luckily, I recognized one of those, metoclopramide. I believe it's Reglan here in the United States there.
Reglan is a prescription medication primarily used to treat and prevent nausea and vomiting by increasing muscle movement in the stomach. Also, just a real quick note, kind of sucks that he had to run up to the cockpit. There should be a phone in the back of the plane. They should have just given him the phone to talk to the pilot so he didn't have to run back and forth, but different flight attendants, right?
Brain is a little different. So we give that dose, patient starts feeling a little better. We go in, I tell the pilots, they say, great. I'm like, we solved the problem, the patient's stable, we'll keep checking vitals every hour. Walk out of the cockpit, there's another person laying on the floor right next to the cockpit. Oh. And I look at the flight attendants, I go, what's going on? They go, doctor, another patient, you have to help. And I go, what? I was just about to sit after a 2-hour ordeal. This individual ends up speaking English, which made it a lot easier for me, much more difficult for the French nurse. So they left. They're very lightheaded, dizzy, nauseous, asking if I have Dramamine. And I asked, are you?
Okay, so this is actually something that we would have to deal with in a completely different way than what probably he's going to deal with. And that was one of the things that I wanted to tell you. I've had 3 passengers on my plane with those exact symptoms who also passed out while heading to the bathroom. Hit the floor, passed out. And 2 of those times I was by myself. One of those times I actually had a paramedic on board. I had this paramedic pilot who told me that what I did was wrong. I gave them oxygen because that is what my manual tells me to do. There's a reason that we do that in the air, and it's very different than what somebody on the ground would recommend. And so my paramedic captain didn't know this. But let me get back into that story in a minute. Let's hear what he has to say, and then I will tell you more about my story at the end.
Someone who gets motion sick on planes, on boats? No.
So Dramamine, I think we all know what Dramamine is, right? It's motion sickness pills so that you don't get nauseous. It's antihistamine medication that prevents and treats motion sickness symptoms like nausea, vomiting, and dizziness.
I don't. Well, that doesn't add up. Why are you suddenly motion sick? And I said, look, based on what you're describing here, I feel like you ate something or just need to vomit out something out of your system. 30 minutes later, as I'm standing there with her, she starts vomiting profusely, suddenly felt a lot better. I explained that it's possible that she ate something that didn't agree with her. Perhaps she had something on her hands. Flight attendant says, okay, look, I'm filling out this paperwork on the first person. Tell me what happened with the second one. I proceed to tell the story, and I said, well, probably food poisoning. And she goes like this. And I'm like, what did I say? Is that a problem? Doctor, if it's food poisoning, that means we have to do a food analysis, and there's like a whole protocol for this. And I'm like, oh, well, maybe it's not food poisoning because no one else is sick. Maybe she just ate with dirty hands. She goes, we'll go with that unless someone else starts getting sick too. I said,
That's interesting. Since I'm regional, we don't have that issue. They haven't taught us to do that. We don't generally serve meals. We serve bags of snacks that are secure. And then we do have some smaller meals, but all of them are shelf-stable meals and the type that can sit at room temperature overnight. So there's a little difference between international flight attendants, like what they have to deal with versus what regional flight attendants have to deal with.
fair enough. We fill out her paperwork. Now I can go back to my seat. There's like 3 hours left in this flight. I'm like, maybe I'll get a little shut-eye. I sit, I'm like, cool, I'm gonna watch this movie. No, not a movie, I was watching The Agency. I start watching the first episode, 20 minutes in, the flight attendant comes over. I'm like, oh, she's probably gonna say thank you for helping me out earlier. And she goes, there's another one. I said, no, come on, you're joking. She goes, no, we need your help. Please come to the back of the plane. I'm like, no way, this is happening. A third one. This has got to be a Guinness World Record. We have to call David Rush.
I've broken about 300 Guinness World Records titles.
Wow.
By the way, my girlfriend the whole time, knocked out asleep, doesn't know what's going on. When I was in the cockpit for the second time, telling the pilots about not diverting, she texts me, where am I? And it's been a really long time that I've been in the bathroom. And I'm like, I'm not in the bathroom, I'm in the cockpit. And she just goes, you're messing with me, right? And I'm like, no, I'm in the cockpit, potentially diverting this flight. And apparently that wasn't scary for her because she went back to sleep while I'm dealing with third patient on this flight. I basically did hours, which is what we call like working in a clinic. I ran clinic in the sky. So I go back to see patient number 3 or individual number 3. Turns out this individual got lightheaded going to the bathroom, no chest pain. He does have diabetes and perhaps not greatly controlled diabetes. He said his sugar yesterday that he tested was 180, which is high, but not medical emergency high. So I said, let's check it now. In the medical kit, they actually had a finger stick, a glucose finger stick monitor. So we checked with the glucometer, the sugar, it was 210. I say, you're not allowed to consume any more sugars on this plane. Let's just have you drink water. We get him to drink some fluid.
What would a flight attendant have to do with a diabetic patient? I have had 2 instances where I've had diabetes problems on one of my flights. One was actually not in my plane. It was in the jet bridge as my passengers were exiting. And basically, this woman had not eaten all morning, not eaten during the flight, knew she had diabetes, didn't take the cookies, didn't take a soda, didn't take a juice. And as soon as she went to walk off the plane, she passed out. They usually tell us to do stuff like give them juice. The other flight attendant that was with me, she was more senior than I was. So she yelled at me to go get the orange juice, and I didn't question it because I hadn't pulled out my manual. I went and grabbed a little bit of orange juice, brought it back. The passenger drank it, immediately threw it up. The paramedic that came from the airport was super pissed that we gave her orange juice, but that's what we're told to do. So I would say if you are diabetic at all, make sure you bring your own snacks. The other diabetic patient that I had, it was an almost emergency. It was this day when the weather was super bad. We were going from Chicago to St. Louis, which is a very short flight, but we ended up sitting out on the tarmac for 2 hours. And basically, I was the first class pass flight attendant. She was in my first class. She told me at some point, my blood sugars are starting to drop. Do you have any types of certain snacks? She had a very particular diet that she could take. And we didn't have anything that she could eat. The other flight attendant and I went through every cabinet on that plane, found every snack that had been left behind. And she had a lot of dietary restrictions like gluten-free, and she couldn't have sugar, and it had to be this and it had to be that. Everything we offered, she couldn't take. I had told the captain before we started trying to do all of this that this could potentially be a problem because we hadn't taken off. And she told me that there was a very good chance that we would be mid-air and she would pass out. I was like, what do we do with? We had been sitting out there for over an hour and a half. We had already given treats to everybody else, but the weather was so bad they wouldn't let us take off. So we ended up going back to the gate. And here's something that kind of sucks as a flight attendant. Most of the time when we have a medical emergency, pretty much all the time that we have a medical emergency, when the person is taken off the plane, we never hear about what happens. There's no follow-up for us. So we don't know if the passenger lived or died or how long it took for them to recuperate. We don't know anything. With this lady, the one that we had to go back to the gate for, I was able to track her down through Facebook. I reached out and I asked her if she had made her trip. Did she make it to go see her daughter in St. Louis? And she said no. We had a very nice, friendly conversation. It was nice to get that follow-up. So if you ever do have a medical emergency on a plane, I hope that you will let the flight attendant know, let the crew know what happened. It's very easy to do. All you do is you go to the airline that you flew, you look for the contact us button, which is probably down in one of the corners, and you click on it, and then you just put in your flight details. I was on this flight, I had this medical emergency, this is what happened. And if you are thankful to the flight attendants or the pilots for what they did, let them know, because then they'll get credit for the company for helping you. Because believe it or not, even with medical emergencies, we don't get any kind of credit for that. We only get credit from the company if the passenger says that we did a good job. Otherwise, it's just what's expected of us. It's not above and beyond. It's not extra duty. It's just average. So keep that in mind. If you ever have a medical emergency on the flight, please let your flight attendants know by just going and hitting the contact button on the website and just saying what flight you're on, what happened, what were the end results. We would be so grateful, because then the company tells us what happened, and we usually get credit of $1 for something like that. But mostly we just want the closure. So sorry, I distracted from that. Let's go on to this.
He rehydrates up, feels better, get him back to his seat. 10 minutes later, his wife gets me again. Not feeling well, he's shivering, I'm really worried. I come back and I see that this is one of these psychosomatic reactions where he's really worried about something bad happening because the severity of what he was experiencing was not matching the physical exam. And I explained that it's not unusual that he's very worried about it. Perhaps if he has his medicine for his diabetes, we can consider taking that. He takes metformin, which is one of the old school medications that we use for diabetes. It works quite well. It's not like insulin, where if I give it to you, it lowers your blood sugar right away. In fact, when I start a patient on metformin, it takes at least a week or so, maybe 2 weeks, to actually see its full impact on someone's average blood sugar. But this patient was very worried. The patient says that he takes 500 twice a day, which is a pretty low dose of metformin. I said it's totally reasonable to take an extra dose. And I said that knowing that it probably won't change his blood sugar in that moment, but I knew it would give him some reassurance, and there was no medical reason not to. So I said, you could take one now. He said he took it, he right away felt better. Which I know medically it didn't change anything, but the placebo effect was real. He stayed calm for the rest of the flight. Like an hour later, we landed. It was an incredible experience. I started getting emails the second we land. Air France, here's a credit for volunteering, $350. Second email, here's a credit for volunteering again, $125. I'm like, why was the first one $350? Higher acuity? Did I get more RVUs on that one? The flight attendants were very grateful. They were very kind, very sweet, very helpful, followed all the protocols to the T. And as we're walking out, she hugged me and said, you're an angel. Thank you so much for helping. And holds up a paper like this with a QR code on it. And she goes, do you mind scanning this? And I'm like thinking to myself, oh, she's gonna give me another frequent flyer thing. I'm like, I don't need it, it's okay. She goes, no, please scan it. And I go to start scanning it with my phone. I'm like, what is this that I'm scanning? She goes, oh, we want you to join the Doctors on Board program. Oh, the next time you're on a plane, we don't have to ask if there's medical doctors on board. We'll just go directly to your seat. And I'm like, oh my God. So I'll be volunteering to be the doctor for Air France for as long as I live. Perhaps I want to reserve the right to not volunteer if I don't feel well or if I had some alcohol. So I'm not going to sign up for this program. But it just goes to show it's unpredictable taking flights these days. And some people say it's because of air traffic controllers. And that's true. There are delays, but there's also a lot of medical emergencies. I have never met a physician who's had 3 separate medical emergencies that all worked out to this extent. Even the nurse who was on the plane with me, I thank them for their help as well. They sent me a DM like a few days after saying that their colleagues knew who I was and they were jealous and everything worked out for the first patient.
I want to read that. Hi, Mike. I am the French nurse who was with you on the New York-Paris plane. How have you been since then? The jet lag is not too complicated? I had good news about the patient who had a nephric colic. She is fine. She was discharged from the airport hospital 5 hours after landing. She expelled the clot from herself, and since then everything is fine. The husband and wife thank us for our work. Otherwise, I have several colleagues who follow you on social networks and who really like what you do. They were almost jealous that I met you and worked with you. That's pretty funny.
Because they ended up going to the airport emergency room. But wow, what a story. I can't believe this happened again. People do a lot of strange things on airplanes, a lot of them unhealthy actually. Click here to check out my reactions to those. And as always, stay happy and healthy.
That was very interesting, wasn't it? So let me get to that part, what we would do for this that's a little bit different than what ground doctors know. So this part right here, this was 3 of my medical emergencies, one of which I was on a plane with another flight attendant, and 2 of which I was on the plane by myself, one of which I did have the paramedic on the plane. And this is like what the paramedic captain was telling me. So we are told when we see these symptoms to give them oxygen, and it usually works. It pretty much always works. Now, he talked about throwing up, which, you don't want them to throw up into your oxygen mask. It's like a scuba tank with a drop-down mask that you see during the safety demo that they put over their face. Here's the thing. I was commuting once from Phoenix to Chicago. And what commuting means is that I was traveling as a passenger, but also as a flight attendant, and there were no available seats for me. So I was riding in the jump seat with the other flight attendants, and I was just in street clothes. And a lot of times what happens after the service is the flight attendants will come back and start chatting, and they'll chat with whoever's in the jump seat. And it just so happened that one day there was a nurse on the plane who'd been a flight attendant for over 30 years. At this point, I asked her about these symptoms. And did I do the wrong thing? Because this captain paramedic guy said that instead of giving them oxygen, I should have been giving him a bag to hyperventilate into, because he thinks that the guy was hyperventilating. And I said, but the oxygen worked. And he's like, well, you just got lucky then. And I'm like, well, this is what my manual tells me to do. And the nurse explained to me that it's basically sensitivity to the thinner air, the higher we fly. So once the air thins out, a percentage of people can't handle the thinner air. It's kind of like, what is it called? Okay, so it's altitude sickness, just like mountain climbers might get if you tried to hike to Everest. So altitude sickness is when your body doesn't have enough time to adjust to lower oxygen availability higher up in the atmosphere. It's usually preventable and treatable. When severe, it can rapidly turn into a life-threatening concern. And basically, the altitude sickness from the thinner air does give them all of these symptoms, and then they feel like, do you have Dramamine? So I don't think it's necessarily what they had on the ground. Very likely, if they gave them the oxygen tank, then that would help. The reason that my passengers passed out on the way to the bathroom is because they thought they were going to throw up. It basically does upset your stomach acid, and they can't tell if they're going to pass out or throw up, so they try to get up and run to the bathroom. The very first passenger that I had an issue with this, he had asked me to sit down and keep him awake because he was afraid if he fell asleep, he would pass out again, and that we wouldn't know if he was passed out or asleep. So I sat with him the rest of the flight, and he explained to me all this. And I had given him the oxygen bottle at the time. He started to give it back, and I was still holding it and talking to him when he started feeling nauseous again and asked me if he could have it back. So I just left it with him the rest of the flight. But he had told me how he had thought that he was going to throw up. He tried to run to the bathroom, ended up passing out in the aisle and hurt his knee. He was very careful now whenever he was on a plane, and usually he was fine as long as he didn't fall asleep. For you, if you have any kind of sensitivity to oxygen at all, you might want to travel with some kind of, I think they're called CPAP machines, those kind of machines that you sleep with at night to give you oxygen. Those can help you on a flight. And as far as I know, you are allowed to use those on the plane. They will not help you in a decompression. If the little masks were to fall from the ceiling, you must immediately put it aside and use those, because from what I understand, those machines take the oxygen that's in the air and kind of amps it up a bit. But in a decompression, you suddenly don't have oxygen in the air. That's getting sucked out of the plane because you're usually too high for that. All of these are actually symptoms of altitude sickness. If you're prone to motion sickness at all, this can help. Another thing that can help, which is going to sound totally crazy, are these C-bands. And I recommended them before. Surprisingly, these work incredibly well. Basically, these little marbles go on the inside of your wrist. You can see it in the picture there. And it creates an acupuncture point that will help with the motion sickness. And it really works. I found out about it when I was pregnant with my youngest, and I flew and I proceeded to throw up everywhere. Any kind of motion sickness, it helps. When I first became a flight attendant, I was motion sick for a good 2 months because I wasn't used to the thinner air on our planes. I wore these for 2 months and they took care of it. After 2 months, I finally took them off to see if I was still sensitive, and my lungs and everything had adapted to the thinner air in those planes. So that's just something to keep in mind if you are prone to motion sickness. If you do want to take Dramamine, it's best to take one the night before you fly, and then possibly before you get on the plane as well. Yeah, so it was a nurse who was a flight attendant who told me that. And so what the airlines recommend to us is based on studies that they do flying with thinner air. And so the ground doctors don't necessarily know that. The ground paramedics don't necessarily know that. But now you do. So next time you fly, you know that. And next time you fly, if you're diabetic, make sure you always bring the snacks with you that will help you, because we are told to give you orange juice, apple juice, or some type of soda if you like soda, in case you start to have a diabetic crash. Generally, most planes only have pretzels, cookies, sodas, and juices. So make sure you take your stuff that you need if you're flying and you're diabetic. As far as that first one, you would have seen me running back and forth to the cockpit. Luckily on the 175, there's 2 flight attendants, so the other flight attendant would probably be relaying to me or vice versa, depending on which one of us is calmer in a medical emergency. One of us would be handling what's going on with the patient, and then the other one would be talking on the phone back and forth. So grab your remote, guys, because this is where I'm going to connect to that next video, the one where he talked about him being the reason that there is now epinephrine on all of the planes that go in and out of the US. Any planes that the FAA has to do with now have an epinephrine pin because of Dr. Mike. I hope you guys liked him, and I think his channel is very interesting. I fully think what he's doing is great. I love reaction channels, obviously, otherwise I wouldn't be doing one. And I'm hitting subscribe. How about you guys? Thank you guys for watching this video with me today. If you liked it, please let me know by hitting the like button. Leave a comment below if you want me to react to other videos like this. Also, hit the subscribe button and the notification bell, because as you know, as a flight attendant, I never know when I'm gonna be able to post videos. I'm trying to be consistent on Tuesdays to post them, usually around midnight, which is more Wednesday morning. So hit that notification bell to make sure that you're always in the know. Thank you guys for watching, and see you in the next video. Ciao.